The Mpox has been declared as a disease of international concern by the World Health Organization. It is a viral illness caused by the monkeypox virus, which is a species of the genus Orthopox virus. It is a double-stranded DNA virus which has two distinct clades of the virus, clade 1, which has two subclades 1A and 1B, and clade 2, which has two subclades 2A and 2B. Clade 1 monkeypox is currently spreading now, and it causes more severe disease, especially in children. In the year 2022, there was a global outbreak of the milder clade 2B strain. Mpox continues to be a threat today, as there has been an uprise of numerous cases in the Democratic Republic of Congo and other countries. However, in India, only 30 cases of Mpox have been reported thus far, and with most of them being from travel-related or among African nationals living in India. Mpox has a long incubation period. The symptoms may not appear for 5 to 13 days, or even up to 21 days in some cases, but usually after 1 to 5 days, characteristic symptoms of Mpox begin to appear. These symptoms are divided into three phases: first, the prodromal phase, and second, the symptomatic phase, third, the rash phase. During the prodromal phase and symptomatic phase, symptoms such as fever, headache, muscle aches, back pain, fatigue, and swollen lymph nodes are usually seen. During the rash phase, characteristic skin rash or mucosal lesions are usually seen, which can last for up to 2 to 4 weeks. The rash begins as macules and then papules, then later becomes a fluid-filled blisters known as vesicles, and then into pus-filled blisters known as pustules, before they eventually ulcerate and become necrotic scabs. This whole cycle takes 30 days, during which the patient remains infected. These lesions can be seen mostly in the palms of the hands and soles of the feet. The reservoir host of the virus is unknown. However, squirrels could be the reservoirs from which the virus is transmitted to humans. An Mpox-infected person with unhealed rashes or lesions may transmit the virus to another person via skin-to-skin contact. Other ways Mpox can be transmitted could be by touching surfaces that the infected person has touched, or used clothes, bed linens, or towels that the infected person has used. Respiratory droplets and aerosols from prolonged face-to-face contact with infected persons, or sexual contact with an infected person can also lead to transmission of the disease. Vertical transmission, where during pregnancy, an infected pregnant mother may transmit the virus to the fetus, leading to stillbirth or death of the newborn, along with complications to the mother. The treatment for Mpox is generally supportive. The illness is usually mild, and most people will recover within 2 to 4 weeks without treatment besides rest and fever-reducing medicines. Patients should be kept well hydrated and isolated. You should wear gloves and masks and regularly wash your hands if cleaning or washing linens or clothes of the infected person, and avoid shaking the linens, which can release Mpox into the air. Smallpox vaccine is 85% effective at preventing Mpox if given within 3 days of exposure. Previous smallpox vaccinations can provide some protection against the severe disease, but it does not provide lifelong protection from getting infected or infecting someone else with Mpox. Tecovirimat and other antivirals are currently under study to determine their effectiveness in treating the infection. Diagnosis of Mpox is done by PCR testing to detect the viral DNA. As of now, the Central Drug Standard Control Organization has granted approval to Siemens Healthineers to manufacture RT-PCR testing kits in India for the detection of Mpox. The IMDX monkeypox detection RT-PCR assays are molecular diagnostic tests that target two distinct regions in the viral genome, spanning both the clade 1 and clade 2 variants of the virus. These new kits will provide results within 40 minutes, which is much faster than the traditional methods.